Good evening, everyone. My name is Cordelia Padua. I am in NURU 641 with Dr. Clary. My teaching tool is on carbamazepine, also known as Tegretol. Patient's profile. Joe, a 45-year-old male diagnosed with bipolar disorder since age 24. His highest level of education is 11th grade. Joe stated that his previous providers have tried him on different psychotropic medications in the past, but nothing have managed his disorder long term. Joe now turns to us looking for new treatment to control his disorder. Drug class and use. Tegretol is in a class of anticonvulsants. Other uses include anti-manic agents used for bipolar disorder. It works by decreasing abnormal electrical activity in the brain. Use of Tegretol. We are giving Joe this medication to treat his bipolar disorder. This medication can also be used to treat people with epilepsy and trigeminal nerve pain. How should Joe take this medication? Tegretol is usually taken 2 to 4 times per day with or without food. Joe will be started on low dose and the dose will slowly increase over several weeks. The dose usually ranges from 200 milligram to 1600 milligram per day, but some patients may require more based on their symptoms. Only your provider can determine the correct dose for you. That means that you should not take any medication outside from what your prescriber have prescribed for you. What happens if Joe misses a dose of Tegretol? If he misses a dose, he should take it as soon as he remembers, unless it is close to the time for his next dose. Joe should discuss with his healthcare provider. He should also refrain from taking double dose of this medication and take it as was prescribed by the physician. What should Joe avoid while taking this medication? Joe should avoid drinking alcohol or using illegal drugs, as they may decrease the benefits of this medication or worsen his condition, and it may also increase his adverse effects and cause him more harm. Joe should avoid consuming large quantities of fresh grapefruit juice, as this may increase the level of Tegretol and increase the risk of side effects. What happens if Joe takes an overdose? If he overdoses, Joe should call his doctor immediately or call 911. He may need urgent medical attention. He may also contact the Poison Control Center at 1-800-222-1222. What are the possible side effects of this medication? There are common side effects such as dizziness or drowsiness, unsteadiness when standing or walking, nausea or vomiting, dry mouth, constipation, blurry or double vision. There are rare serious side effects of this medication. Tegretol can cause him to have a decrease in body's sodium level. He will know this because he will experience nausea, tiredness, lack of energy, headache, confusion, or more frequent severe seizures. If this happens, he should call his medical provider. Uh, Tegretol may cause rare but serious blood problems, including low white blood cell counts. The symptoms may include fever, sore throat, other infections that come and go or do not go away at all, easy bruising, red or purple spots on his body, bleeding gums or nosebleeds, or severe fatigue or weakness. In most serious rare cases, a disease known as Stevens-Johnson syndrome, a severe skin reaction will result, as you can see in the video. Um, the symptoms will include swelling of the face and lips, as you can see, lips, tongue, difficulty swallowing or breathing. When this happens, this medication should be discontinued immediately, and call your medical provider. What should Joe know that are most important about this medication? Tegretol requires long-term treatment. It can take anywhere between 1 to 2 weeks to take effect. So Joe should not stop taking this medication even if he doesn't see any changes within a few days of taking this medication. He should not stop taking this medication even when he feels better. Missing doses of this medication may increase his risk of relapse or his mood symptoms. He should not stop taking this medication or change his dose without talking to his healthcare provider. In order for this medication to work properly, it should be taken every day as prescribed by the healthcare provider. And this is the end of my presentation. If you have any questions, I can be reached at cpadua@mail.brandman.edu, and below my references. Thank you for listening. Goodbye.